Thanks for joining us here. I'm Brooke Katz. Right now, Dallas County getting ready for a news conference. We are going to be hearing about new restrictions that start at midnight. That includes the closing of hair and nail salons. We want you to listen in now live.
You start now?
Yeah, anytime.
Okay, great. So, good evening. We have some changes in the control order, and I want to talk to you about those and a couple of other things. We are closing immediately, that is at midnight tonight, nail salons, hair salons, beauty salons, hair removal services, spas, tattoo and piercing parlors, and all other non-medical personal care services that cannot be provided while maintaining appropriate social distance, which is 6 feet. Further, effective at midnight tonight, all elective medical, surgical, and dental procedures are prohibited anywhere in Dallas County. Hospitals, ambulatory, surgery centers, dental offices, and other medical facilities are directed to identify procedures that are deemed elective by assessing which procedures can be postponed or canceled based on patient risk, considering the emergency needs for redirection of resources to the COVID-19 response. This next one will probably be the one I'll spend a little time talking to you about. This order places a limit on the sale of toilet paper. This was done in direct consultation with the Retailers Association, and because some of us have not moved from selfishness to sacrifice, all sales of toilet paper occurring in Dallas County are now limited to 12 rolls per purchase, or if you find a package that has more than 12 rolls, you can buy that one package. You can buy 2 6-pack rolls of toilet paper for 12, one 12-pack, 3 4-packs, or if you find something bigger, then you can buy that. There won't be many bigger because people keep hoarding the toilet paper, and some people are now reselling the toilet paper on eBay. And so the manufacturers have moved to making 6-packs. It's the fastest way they can build those. And they've shown me pictures of warehouses full of toilet paper that the trucks are picking up every day and bringing out the stores. But for whatever reason, I don't think anyone's, for whatever reason, we're buying a lot more toilet paper now than we were buying before. There's, again, let me say this about, it's a surreal time that we live in when I'm having a press conference and spending a lot of time on toilet paper, okay? But there is not a supply chain problem with the toilet paper. Folks, we are the problem with the toilet paper. When I say we, I mean shoppers are the problem with the toilet paper. The hope of this is we'll do this for about 2 weeks, then we can relax that. But for now, effective midnight, you're going to be limited to 12 rolls of toilet paper, and that way everyone who goes to the store can go to the store and get toilet paper. And let's talk about other items in the store, okay? I want the public to keep in mind, you've got people that it takes a heck of a lot for them to get to the store. Maybe they have to use public transportation and drive a long distance. Maybe they're a senior citizen or mobility challenged. And so when they use their hard-earned dollars and time to get to that store, and if they're older or immunocompromised, when they run the risk of going to the store, and the items that they need aren't there, that's just wrong. And so we've got to, this is the only one item, toilet paper, but we've got to move as a whole group. It's just like these other control orders. The whole lot of us, the whole group of us, have to move from selfishness to sacrifice. We have to stop taking every can of beans, everything on the shelf, all right? Another thing on the toilet paper. if you do run low on toilet paper, and we're trying to keep that from happening, especially as we move to more and more time in our homes, I want to explain this to you. When you flush tissue, Kleenex, that is not more expensive toilet paper. That biodegrades differently. Kleenex expands, it brings in water. Toilet paper disintegrates. If you flush Kleenex, your pipes will stop up. And the last thing we want is for your pipes to stop up if we're stuck in our homes, right? So I talked to plumbers who are busier than ever before because people are flushing Kleenex because when they go to the store, they can't get toilet paper. If you have to use something other than toilet paper, and we're working hard to keep that from happening, then you need to dispose of that in some way other than flushing it. And again, that is going to be the strangest press statement that I ever hopefully will make. Okay, here's another thing. If you're using outdoor spaces like the Katy Trail, you're going to have 6 foot distancing. We'll have officers, and people might be ticketed if you don't keep 6 foot distancing. The other day I talked about limits on sports, okay? We are stopping any outdoor activities that don't have 6 foot distancing. So I used an example in an earlier press conference about a pickup basketball game. You know, I know people love a good pickup game, but you can't play basketball and defend one another without being within, obviously, 6 feet. And so outdoor activities within 6 feet are also banned by this order. A couple other things I want to talk to you about. I'm not saying the names of those who pass away from this virus. We had our first death last week, but I do want people to know that our hearts and prayers are with that family and with everyone who is struggling with this virus, but also with those of you who are struggling with the economic hardship that these things are causing, and I certainly recognize that. Here in Dallas County, we are working with our utility companies to make sure that no one's service is disrupted. Their utility service is not disrupted. I think it's very important, and I'm asking the governor and the PUC to suspend, as we have done now, following after the county did it. The Supreme Court came in to suspend some evictions in the whole state. We got to flatten the curve regionally, so we really need to stop utility cutoffs. I think as you see these 2 big states, New York and California, moving to shelter in place, you know, that looks like, if this curve doesn't flatten soon, that's where, you know, large chunks of this country and this state will be going. And so it's absolutely essential, if people are stuck in their homes and they can't work, that we do not cut off the electricity, gas, or water to their home. I want to give a shout out and a little bit of good news on this as well. We will receive our first shipment tomorrow from Bent Distilleries of Louisville. Bent Distilleries is the first of what I hope will be many distilleries who have stopped making liquor and started making hand sanitizer for first responders. And so tomorrow a DISD truck will go to Bent Distilleries, pick up our first shipment, bring that back to a DISD facility, and our first responders will be able to go by there and get the supplies that they need. So that is a bit of good news. The first day of the test site at the AAC went very well. They were able to see everyone that qualified with the 99.6 temperature if you're over 65, and the first responders that qualified under their guidelines, and healthcare workers. The last thing I would say, and this is something that I'm calling on our business community to do, we cannot wait any longer for the retooling of manufacturing to build more PPEs and more ventilators. North Texas, you are amazing. Our business community is amazing. Together, you can do anything. We have to have garment manufacturers step up, retool, and make PPEs for our first responders and for our healthcare heroes. If those folks get sick, there's nobody to take care of the rest of you when you get sick. So we've got to protect them. We've got to stop them from running out of masks and the important things that keep them safe. Ventilators. I think people are understanding that there are not enough ventilators for what we are facing. We have got to retool, and those who can need to do in this country what Jaguar is doing in Great Britain, what Fiat is doing in Italy, and what manufacturers are doing already in every country that's been hit that has manufacturing but ours. We're not going to wait on the federal government on this. We're going to lead on this as a business community, as a manufacturing community, because it's too important that we have these things that our healthcare leaders need to keep you safe. And with that, I'll turn it over to Dr. Wong.
So this morning we reported 21 new cases of COVID-19 that were reported. This brings the total to 95 for Dallas County. Also, about 40%, over 40% now of our total cases have no known travel history outside of Texas or exposure, close contact to a known COVID case, suggesting then that over 40% now are due to community transmission. So these social distancing that are included in the order just are more readily apparent, the importance of it. In particular, I mentioned the having no elective medical, surgical, dental procedures. A part of that is also really, as the judge mentioned, we need to protect the personal protective equipment. We need to protect the ventilators and the usage for what may come. And so that's really an important policy to try to protect those vital resources. We're starting to see more of things escalating in New York and other places. And so again, we're all trying to slow this spread down so that it protects our vulnerable population as well as our healthcare sector. So these are important actions that the judge is announcing, and will protect our public health. Thanks.
Judge, kind of talk about, are the new addition restrictions directly in relation to that spike of community spread, directly connected to, there's 40% community spread from the 95 cases? Is that what kind of triggers you guys saying, okay, we need to further make restrictions?
Well, let me tell you what has caused them. So when it comes to the surgical, the elective surgical procedures, once again, and as I've said before, we will not wait around to do what the clear directions that come out of the CDC. And so Dr. Birx, the person President Trump put in charge of COVID-19, made it very clear in her directives to governors. There was a meeting yesterday, I think, with a board of somebody, dental examiners, I think. They chose not to act in Texas as the CDC and Dr. Birx recommended, so we're doing it here. But let me tell you a really great thing that's happening, and I'm so proud of them. Tarrant County is doing the same thing. And that's what's got to happen to flatten the curve. We've all got to do this, right? I mean, this is a very interconnected place. If a county of 1 million people is on the sidelines, you know, and I'm not picking any particular, or a county, whatever, is on the sidelines, it makes it really hard. Tarrant County has stepped up, and we need the other counties to step up. Together we can flatten the curve, but it takes all of us.
Could you go into, give some examples perhaps on elective procedures, what those might be to the
Well, so Peter Bonowitz, who was up until earlier this year.
All right, you've been listening there to Dallas County Judge Clay Jenkins giving an update on some new restrictions going into place tonight. That happens at midnight. It will include the closing of salons and spas, non-medical personal care services, elective medical and dental procedures now prohibited, and also a limit on the sale of toilet paper included in that. A lot of changes happening, and we will be bringing you more information on that tonight at 10 o'clock.